Dr. Zurita, on behalf of our entire team at the Center for Spine and Orthopedics and the Spine Education and Research Foundation, Dr. Rumley, Dr. Levy, Dr. Leinbach, Dr. Leo, our providers such as Rachel and Kate and myself, it was a great honor to host you for the last year of your training before you take off to embark on the next chapter. You clearly check all the boxes that we look at when we are introducing and training another surgeon. You have head, heart, harmony, and hands. I've used that throughout most of my career. I learned that from my mentors. Clearly, you're a very bright individual. You clearly have great heart, got along with everybody, and you have great skills from a hands that you can convert to a talent. We hope that you can reflect on your fellowship and come up with the value. And many times the things that happen to us in life, both your residency and your fellowship, sometimes you don't understand the value until you reflect on the past. And so I asked some of our past fellows to give a short video for yourself and a memory of why the fellowship was important to them, and they're at different stages of their career and how it's had an impact on them. And maybe that will give you something to reflect on.
Where I feel that the true strength of the fellowship with Mike is what we learn outside of the operating room. I think Mike's fellowship really introduces and exemplifies how to take care of our spine patients, not only in the surgical setting, but in the clinical setting.
With regards to fellowship, I think it means different things to different people, but the common themes would be mentorship, learning, apprenticeship, networking. For me, my special takeaways were to always be ready to step out of your comfort zone, to question yourself, and to learn the best of your ability to seize the day. I will always remember Cozumel like it was yesterday. I will always remember Saratoga like it was yesterday. And obviously, I will never ever forget Sturgis. And these are experiences that are burned into my brain, and I will take them with me for a very, very long time.
The fellowship has basically made me who I am in terms of my professional career.
I'm a former fellow of Dr. Janssen's from 2019 to 2020, about 3.5, 4 years now into my practice. I elected to take an employed position at Community Hospital of Anaconda, Montana, small rural community. I decided to do the fellowship with Dr. Janssen long before I actually joined his fellowship. He's been a mentor of mine for a long time, dating back to my third year of medical school. We stayed in touch, and I was more than honored to come back and learn from him as a fellow. I admired his practice. I still do. His skill, his expertise. There's really no better place or surgeon to learn from than Doc.
In about the 4th year of residency, I decided that I was interested in spine and started looking at different fellowship opportunities. I called Dr. Janssen. We had a mutual friend by the name of Dr. Les Bertrand, who was a pediatric spine surgeon in Augusta during my residency. Dr. Tran recommended that I call Dr. Janssen to talk about the possibility of doing a little extra training in spine. At that time, there was not a spine fellowship at Dr. Janssen's place in Denver. However, to make things short, he created one. So he and I got to be friends. We decided to do some extra training in spine after my orthopedic residency. And I'm sure it does not surprise you to know that Dr. Janssen called around and actually created a 1-year credentialed orthopedic spine surgery fellowship in about 3 months. And so lo and behold, I then decided to go out with Dr. Janssen and do a 12-month fellowship.
What I really appreciated looking back at fellowship is how Mike emphasized patient education. Mike really spent the time with patients making sure they truly understood their spinal pathology, whether it's using dry erase boards, drawing diagrams, or using various analogies, so patients left understanding what is happening with their spine and all the different non-operative and operative treatment options. This is something that I've incorporated into my practice, and I feel that your patients will truly appreciate this as you take care of them.
Looking back on my fellowship, I'm so grateful for the opportunities to learn all aspects of spine, but also medicine and learn how to create and build a successful practice. I had mentored students, and it really, truly made me the surgeon that I am today.
My experience learning with Doc has been nothing short of awesome. I just wish that this is going to be the beginning of a lifelong learning journey.
And I met Mike during my interview as he had done the same fellowship, and I immediately liked Mike. As you know, he's got a very friendly manner about him and very engaged, and he's just an amazing person. And you meet that the first time, you know that the first time you meet him. So he took me in the mountains on my interview, and we started talking, and I immediately just said, this is a great place to do a fellowship. So that was how I ended up at Lakewood Orthopedic Clinic, and Mike was an integral part of that fellowship. And in fact, I would say from all the surgeons that I work with, by far I learned the most from Mike.
Overall, this was a wonderful experience as I got to know everybody and learned a tremendous amount about spine surgery.
And if there are any prospective fellows in the audience, I wish that you would have every bit the same amount of success as David has had. Good luck, everybody.
So, Dr. David, I hope that gave you a little bit of an overview of what a spine fellowship really is all about. First, I'd like to thank the past fellows that took a few minutes of their time to gather their thoughts and describe to you a little bit upon what it means as they look back at a spine fellowship, including but not limited to Dr. Grisoni, Dr. Patel, Dr. Max Sims, Dr. Ottemeyer, all made substantial reflections on what a fellowship is. I think a fellowship is really a philosophy of spine care, and it gives you a platform to look at technologies, patient safety, patient care, and at the same time, it gives you a platform for lifelong learning. Now let's kind of take a look at some pearls and wisdoms that you may reflect on over your career now that you have all this knowledge, experience, mentorship, finishing from college to medical school, to residency, to this transition of a fellowship, and what you've gained from all of our team here to go forward. And let's take a look a little bit upon what some of their thoughts are on a few keys, pearls, and wisdoms for you.
Oh, hey Zurita, I didn't see you there. You caught us working away.
Oh, Dr. Zurita, congratulations. You've completed your spine fellowship at the prestigious Center for Spine and Orthopedics. You did a great job this year, period. I think you're going to make a great spine surgeon. Make sure you take care of your family. Make sure you use your resources. Feel free to reach out to us anytime. And trust your instincts. You're going to do a great job, and I'll come see you in Missouri someday. Probably not.
Zurita, my piece of career advice for you, period, is that you get a really, really good PA like me so that you can just coast through life as a spine surgeon the way Dr. Romley does.
End of dictation.
I know it's of no help that Kate is helping you, and we use the word help very loosely around this practice, especially when speaking of Kate. You know, David, you've done a great job. More than any fellow, you actually have good skill, good hands. I mean, literally every other fellow that's ever been through this practice, none of them were good. You're great. And I don't think that's an awkward statement at all to have at your graduation dinner with Dr. Levy. I also appreciate that you are so appreciative of your time with us, unlike all the other fellows. All joking aside, though, you've done a great job. I would say I have to, you know, we're asked to give career advice. I'd say things I've learned are, number one, don't do the big stuff to start. Take a couple of swings, because nobody ever steps up to the plate and tries to hit a home run unless they've done some batting practice. This last year has been a lot of batting practice, but on your own is a big one. Number two, good news is good, but bad news never gets better with time. And the last one, and probably the most important, is you'll never, on your deathbed, say, man, I wish I would have done one more case. I wish I would have spent one more day in the OR. value your family and your time, something that I've learned very recently to really start paying attention to. So good job, man. Congratulations, and can't wait to not go to Missouri.
Oh, yes. I want to encourage you to move forward into your practice aggressively and assertively. I would advise you not to get in over your head. I think one of the things surgeons do coming out of fellowship is they feel real confident, they're real eager, but at the same time it's important to be grounded and to know your limits.
On days that you will question yourself as you go out into your practice, which undoubtedly you will, remember how long it took you to get to where you are. All of the people who support you, your peers, your attendings along the way. Think of the cases that you've scrubbed, and the answer will undoubtedly come to you. You've learned from the best, and so you'll most certainly achieve your goals and find success. Just remember to always put your patients first. Congratulations, Dr. Zurita. You're going to do great, and I look forward to hearing about your successes in the future.
David, buddy, today is a big day for you. So many things to be congratulating you for. I want to congratulate you for selecting a really wonderful place for your fellowship. I want to congratulate you further for having completed the program with relative ease, I would say. I'm sure most people agree with me that your calm demeanor and your nerves of steel are going to put you in a very good place as you embark on your personal practice as a spine surgeon. It was wonderful to have caught up in Bangkok. I just wish we had more time to catch up with each other. But nevertheless, I'm looking forward to hearing about your successes in the years to come. Be sure to keep in touch, man.
Words of wisdom for you as you build your practice and your reputation. I would say be the yes man. If you have the opportunity to take spine call, take it. At least until your spine practice builds.
Hey David, just wanted to say it's been great to have you over the last year. Reminder, I'm Rachel, I'm the PA with Dr. Janssen. So it was fun to get to know you working in the OR. You're a super awesome guy, and it was great to hear about your kids and how you took them to musicals and see Elf at Christmas and whatnot, which you're the reason that I took my husband, so thank you for that. I don't have any great words of wisdom. I think you probably do a pretty good job of balancing work, life, and family and whatnot. So I guess just try and keep that balance as you move forward in your career, and I wish you nothing but the best.
Stick to the indications and you will have good outcomes.
By communicating with other surgeons, interacting with them, sharing ideas, and operating with them, either in your community or going to visit surgeons, you're going to become a better surgeon. And then the other advice I would have for you is do what Mike does so well, which is balance his life. His work life and play life and family life, as you know, is incredibly unique. He's able to do all these things that most surgeons cannot. So make sure you take time out to enjoy the things you like to do.
As you will see, as your years go by, Dr. Janssen continues to be an incredible force as a friend as well as a mentor over your career. So don't ever hesitate to reach back and ask Dr. Janssen questions about cases that may seem complex or somewhat difficult. He's always been there for me to offer advice, and I've thoroughly appreciated that. He also puts together one heck of a motorcycle trip. If there's any reason to continue his friendship, one good reason is all the fun that you can have visiting Colorado and Wyoming.
One other advice I have is you're going to have ups and downs. You're going to have some patients that just don't do well and surgeries that you wish you had done better. But what you should remember is you're trying to do the best for every patient, and not everyone has as good a result as your best patient. So when you have a patient that doesn't do well, just remember the next day you're going to have 5 or 6 patients that are going to come in and give you a hug about all the ones you help. So I have a saying that I never have 2 bad days in a row in medicine, and that's because if I have a bad day in surgery or in the office, the next day is always better. So remember that it's a privilege to take care of these people, and you've learned from Mike how to talk to patients. He's so good at that, and hopefully he's given you all the tools to become a great student of this field and to keep learning, to keep staying engaged and appreciate that all that you've been taught. And it's a great opportunity you've been given.
Dr. Zurita, I know you're going to be well prepared leaving this fellowship. I wish you the best of luck in your career and your future. Good luck.
Best advice I could give you is that number one, you got to remember you're going to the show me state, so they expect you to be genuine. Be who you are. Find out what your philosophy is on treating things and stick with it. But utilize the power of the fellowship. You know, other fellows, Mike, his crew, you name it. But congratulations. I hope things go great, and I know you'll do fantastic things.
So congratulations and have a great career, and welcome to the Lakewood Orthopedic Clinic / Mike Janssen Fellowship Alumni Network. And we're always happy to talk to you about any questions you have. So we're all part of the same group, and I welcome you to that group.
Just once again, congratulations. It's a wonderful place to be, and good luck in your future.
David, it is the end of your postgraduate training and fellowship. And our entire spine team is super proud of you and everything you have done, not only for the year you were here, but for the last decade of your life, professional, between medical school, residency, and now fellowship. It's also really exciting that you have a commitment to a community in Missouri that has a need. And that has to be an incredibly exciting time for you with your family to go on and do the next chapter. Fellowships are incredibly important. You heard from a lot of our past fellows. I did 2 fellowships. My wife did a fellowship in medicine. Both of my kids I encouraged into postgraduate fellowships because today the amount of information we have is always a challenge. What we hope you do, our entire team, specifically Dr. Rumley, Dr. Levy, and myself, hope that you can take all the skills and the knowledge that you've seen and convert it over time to a talent. And this is just a little bit about the history on the right side. Some of our past fellows, I think, have shared with you as they reflect back upon how they were able to process that. And you have to remember that the key is to take care of your patients, their personality, their pathology, and balance out their protoplasm. Because you may have seen a lot of things during your fellowship that you don't want to tackle right away. When I look at the left picture over here, and I had someone commissioned to paint them as part of my career over a decade ago, it makes me take a look at how medicine has changed. And even though we're here to celebrate the past and everything you did, you're at a crossroads. And now, David, it's time for you to shape the future of your career, your family, and the community. And I leave you with a couple wisdoms. And when you think about this and how many people are sitting in that room before sterile technique, and then they're doing one thing that we all think, Dr. Rumley, myself, Dr. Levy, Dr. Leinbach, Dr. Leo, that education is important. And you have 2 ways to make the world a better place now, at this point of your career. 1 is one patient at a time. And 2 is education. Education for your patients, education to students when you get a chance, residents and fellows. And that ripple effect will make you have a fulfilled career, a safe career, and make a huge difference in patients. So we wish you the best, and I hope that this collection is something you can reflect on for a number of years.